CLL is the commonest adult leukemia. It's usually a very slow disease, so it's most commonly picked up by chance. In other words, somebody goes for a blood test for another reason and it's found that they have a raised white blood count. In a lot of patients it doesn't actually need to be treated because we know that a lot of patients the disease behaves very quietly and doesn't actually progress over a long period of time. Unfortunately, there are some patients where it behaves less well and we do need to start treatment. And at the moment we're still using chemotherapy, but there is, as I say, a big trial in the UK that's trying to look at whether newer, simpler drugs like ibrutinib will replace that. In CLL, we're in a very exciting era, so we've now got new novel agents which are very well tolerated. They're all tablet form, so we've got ibrutinib, venetoclax and idelalisib, which all show incredibly good treatment in CLL patients, including those that have bad risk disease as well. So the great excitement is that eventually we're going to move away, hopefully, from chemotherapy to these newer drugs. And some of the data that's been presented at this meeting is beginning to show that that looks a real possibility in the future. I think we have to realise that it's not going to happen today, that we are a few years away from being able to do that. The data with drugs used in combination, like ibrutinib and venetoclax, for example, is producing incredible responses and is extremely well tolerated. And I think it will inevitably eventually replace chemotherapy.